Good morning. Any fever within the last 24 hours? Flu-like symptoms? Any contact with COVID outside of jail?
I remember being highly concerned initially about some early reports of how easy it was to find COVID on surfaces and floors, and we didn't know how transmissible it was. We didn't know whether it was mainly going to be a respiratory transmission or a contact transmission or some blend of both. That should be not Monday morning quarterbacked as a problem. I think that's natural scientific learning to better understand how those sorts of transmissions occur for a virus that we had never seen before. But certainly for the first month or two, I would say it was nerve-wracking. And as much as it can be nerve-wracking for me, I know it was equally nerve-wracking for my own family. I'm sure lots of frontline workers would have said the same thing, that they weren't ever 100% sure of what they were bringing home. Yeah, that's a bit uncomfortable when you think back at it. But I'm proud of the ability of colleagues here to roll up their sleeve and come up with some incredibly innovative solutions that kept our own staff safe. We were very fortunate to have such a capable environmental and industrial hygiene group and safety group who were able to be early thinkers in terms of different management strategies for keeping workers safe. We have a large vaccine institute that was really well set up to not only be involved in early trials, but to help us roll out vaccines when they came and be a resource and an education, and that was unique to us. On an individual level, the immense satisfaction and joy of seeing someone who's been sort of critically ill in the ICU walking out of a hospital is extraordinary to feel. I remember a couple of scenarios that just gave some of our colleagues infinite energy to keep on going. It was kind of humbling up front to have so many people in awful situations and yet still be single-mindedly able to say, whatever I can do to help other people not have to go through what I'm struggling with. That's a really amazing thing to hear. We owe them a massive credit. In hindsight, I wish we had had a clearer message with vaccination about things that we would deem as success. To me, success up front was preventing infection. And data in the first rollout of vaccines said these vaccines do it brilliantly. We do also, have now a wealth of 3 years of intensive research globally about how coronaviruses like COVID would transmit. That's a bank of knowledge and awareness that will absolutely help us the next time around to give clearer and likely more accurate sort of recommendations up front early on. So I would expect we'll continue to see COVID present in the community. But for the vast majority of us, this has now become an illness that its impact has normalized. We don't see closures, we don't see airline cancellations like we did 12 months ago. We don't see your restaurant suddenly shut because they can't find staff. I see nothing on the medium-term horizon that would change that. As much as there is a clear tragedy of having so many people sick, die, or still be left impaired because of COVID in complicated ways, I take good heart that at the end of the day, on so many community levels, we were able to come together as a community and actually try and come up with solutions to difficult and evolving problems. If you want to honor the countless millions of people who've died in the last 3 years, it would be done best by, frankly, reminding ourselves that we're not immune to these things. They're going to keep coming. I wish that they wouldn't, but they will. And being at least accepting of that knowledge and being prepared to roll up your sleeves like so many people did in 2020 when the next thing occurs, and be respectful of those who are trying to do their best to handle the next outbreak. That would be a good lesson and a good way of honoring the struggles that I think so many families went through in the last few years.